1 in 5 Australians over 45 have osteoarthritis. The knees and hips are most commonly affected, but it can also affect other joints, and it can affect people at any age. There's a myth that exercise is bad for osteoarthritis, but this is definitely not the case. Numerous studies have shown that exercise is effective at relieving pain, especially in people with knee osteoarthritis. It can also help avoid or prolong the need for costly joint replacement surgery. Osteoarthritis doesn't have to be part of getting older. If you can adopt the right practices to manage osteoarthritis, you can still live well with it and do most of your usual activities. What is osteoarthritis? Osteoarthritis is a chronic condition that affects the joints. It can cause damage to the joint cartilage, which is the protective layer that covers the ends of the bones and joints and is normally smooth to absorb impact. The cartilage can become thin and over time can wear out completely, which can cause the bones to become brittle and make movement quite painful. It may also include inflammation of the tissue around the joint, bony spurs growing at the end of the joints, and deterioration of ligaments and tendons. It's different to osteoporosis, which affects the inside of the bones, causing them to become more fragile. And it's also different to rheumatoid arthritis, which is an autoimmune condition. How is osteoarthritis diagnosed? Here in Australia, osteoarthritis is diagnosed through a GP. This is typically done by looking at your clinical history in addition to a physical examination, which includes some functional tests. Imaging, such as X-ray or MRI, is not required to diagnose osteoarthritis, but may be called for depending on the severity of the pain that the patient is experiencing. What are the signs and symptoms of osteoarthritis? Symptoms can vary between people and the joints that are affected. The early signs can be easy to miss. Your joints may feel a bit sore or stiff from doing something like housework, or you may find you're avoiding or modifying certain activities that cause discomfort. Because it's a chronic condition, it may worsen over time. So, you might have some joint pain and stiffness intermittently at first, but this may become more constant and more painful over a period of months or even years. There are varying presentations of osteoarthritis. Pain and stiffness in the hips and knees is most common, but it can affect hand and finger joints and even the big toe joint. When should you see a doctor? You may not need to see a GP if the pain is manageable, and you can make appropriate modifications to your activities and still do most of the things that you want to do. But if the pain is getting worse and you're worried, it can be a good idea to get medical advice. The end-stage treatment for osteoarthritis in the hip or knee is a total joint replacement. Early diagnosis can be helpful, as you can identify and implement non-surgical and non-drug interventions, which are globally recommended for the management of osteoarthritis. These can be more effective at relieving pain and help maintain quality of life. What are the risk factors for developing osteoarthritis? Joint injury, such as anterior cruciate ligament tear, is a common cause of osteoarthritis in young people. In these cases, we consider this secondary or traumatic osteoarthritis. In many cases, there is not a direct cause, however, but there are risk factors that can make people more likely to develop non-traumatic osteoarthritis. These risk factors include your age. It's more common in people over 45, although it can affect young people. Most of the time, this would occur after an injury. Genetics. A family history of osteoarthritis can put you more at risk. Gender. Osteoarthritis is more common and often more severe in women. It tends to start after menopause, when the laxity of our ligaments can change, making the joints less flexible. Obesity. This relates primarily to excess loading on the joint, which can lead to cartilage degeneration. Alignment of your joints. Malalignment of joints, like for example if someone is bow-legged or knock-kneed, can mean that the load is placed unevenly on their joints. A smaller area of cartilage can carry an excessive amount of load, while another area may carry an insufficient amount of load. We know that cartilage actually needs a certain amount of loading to get the stimulation it needs to maintain its health. So it's not only overloading that can cause joint damage. And your occupation can increase your risk. For example, if you have a job that requires you to lift heavy loads. These are all interrelated, and there may be several contributing factors that can lead to someone developing osteoarthritis. What treatments are there? The recommended treatment for osteoarthritis in most cases is exercise, patient education, weight management if patients are overweight or obese, and modification or limitation of activities where appropriate. A lot can be achieved with these treatments to help people live well with osteoarthritis. In many cases, the outlook is positive and surgery or other medical interventions won't be needed. The benefits of exercise are enormous. While it can be difficult if you're in pain, keeping moving with a tailored exercise program and balancing this with appropriate rest is the best thing that you can do. Any exercise is better than none. This can be low-impact exercise such as swimming and walking, as well as strengthening exercises including yoga. The recommendation is for 20 to 30 minutes of exercise 2 to 3 times a week. How can osteoarthritis be managed? Here at Griffith University, we're developing wearable technology that can help measure how you're moving at home during your regular activities and provide you with immediate feedback so that you can self-manage your condition. This technology can give patients more confidence to help them keep moving. More and more we know that patients strongly advocate for the ability to self-manage their osteoarthritis. There are a range of digital tools emerging to help people engage with their clinician and keep track of their treatment plan. Can complementary therapies and supplements help? Complementary therapies like acupuncture may be beneficial in addition to exercise, but there is limited evidence to support their efficacy. There also isn't strong evidence that supplements such as glucosamine and fish oil are effective. Would surgery ever be needed? Surgery to replace the affected joint may be inevitable for some people with osteoarthritis. Non-surgical interventions, like exercise, may not have the same pain-relieving benefits over time, and the disease may become extremely debilitating. This is the end-stage treatment and can be very effective, but should only be considered after other non-surgical treatments have been explored first. Recovery from surgery can take a long time. We also know that people are more likely to have better outcomes if they've been on a preoperative program involving exercise. Can osteoarthritis be cured or prevented? Osteoarthritis currently has no cure, and we can't prove from a scientific point of view that it can be prevented as yet. But we have strategies to minimize the impact it has on people's lives. We know the most effective time to intervene is early in the disease course when people are still able to be active, and there's the best opportunity for the process of degeneration to be slowed or stopped.